We also have those who majorly have more complaints of swollen feet and back aches. Is that a matter of concern, and is there a way to avert that, reduce it, or is it just a natural process?
Most women will have a bit of swollen feet as a natural process, and backache again as a natural process, part of their pregnancy. When they're carrying a pregnancy, they use the normal mechanisms of actually even the back is not in the right usual position, and that sort of presents some challenges in terms of weight support. That can happen, and we encourage them to remain active, move their back about, and if they're desperate, they can take some painkillers, and Panadol is usually a good choice for that. In terms of swelling of their legs, again, that's a natural process. When the baby is in the tummy, it causes a bit of compression of the vessels inside the tummy, and that can mean that the blood supply from the return from the legs is not quite good. And we encourage them to keep active again, put their legs up when they rest in the evening, and that sort of thing is actually quite innocent. However, there's another small category of women who might develop something we call preeclampsia, which comes with swelling. So if the swelling is not only on the legs but comes to the hands and face, we need to investigate that a little bit further, and that may mean that the pregnancy could be at a slightly increased risk than the natural process.
Maybe without going too much into detail, what is preeclampsia?
Preeclampsia is a condition that happens in the second part of pregnancy, and usually comes with elevated blood pressure. So their blood pressure goes up, and they develop the swelling that I mentioned, and then there are problems with handling protein in their kidneys, so they have a lot of protein coming out in the urine. It does, we quite don't understand what causes it, but it does interfere with the way the baby is surviving inside the uterus. And some babies actually fail to grow up optimally and need to be delivered quite early. For the mother, the hypertension can present challenges, and one of the things that we want to make sure is that we control the blood pressure. Just like in a pregnant woman, that can cause complications, which include stroke and things like that.